My name is Dr. Simon Dardashti, and I am going to be presenting a few different topics, but all under the same umbrella of chronic neck and low back pain. I myself am a pain management physician working with Facey Medical Group in Mission Hills, California. I've been practicing for over 5 years, pain management specifically, and graduated from UC Irvine in anesthesia and UCLA in Los Angeles for interventional and chronic pain management. Today I'm going to talk to you about common areas of pain, common things we can do to prevent pain, and different treatments, dispel a few misconceptions, and we'll get started. Our objectives today are to discuss common ways pain presents and what are the underlying causes. I hope that you kind of understand what the underlying causes are so you can attack the pain and prevent the pain. Another objective today will be to discuss different ways to treat pain and also to kind of dispel some misconceptions we have about pain given the stigmas attached with being in pain and certain treatment modalities. What is pain? Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. So that's kind of the textbook definition that most pain physicians will use, but the main area to always focus on is that pain, it's both physical. We might, step on something sharp and immediately our body moves our foot, or what could happen is maybe stress or emotional, psychological insults, anything that might bother us can worsen pain we already have. But at the end of the day, pain is the way our brain interprets pain. And it is an experience that our brain processes. And that idea is one that's highly discussed within pain and also affects the way in which pain is treated. Common areas or times that someone will have pain, a lot of end-of-life pain, arthritis, circulatory disorders, immobility, nerve pain, cancer. And that kind of affects how the body interprets the pain. A lot of older individuals have lived life where they have been in pain before, and that changes their interpretation of pain. It's been well studied that everyone experiences pain differently based on regions, ethnicities, age, cultural pressures. And there have been several studies to say that community-based cultures tend to downplay their pain because they don't want to impose on others, whereas individualistic cultures tend to be very free when discussing and opening up about what their pain is and how best to treat it. How is pain assessed? This is also a major topic, but for the most part, most pain physicians will use a pain assessment tool, a visual tool, a numerical tool. Is your pain, the worst it's ever been? Is it tolerable? Are you in no pain? Does the pain come and go, or is it constant? 0 to 10 scale, 10 at its worst, 1 at its least. But once again, you always have to compare the pain to the own individual's experience of pain and where the pain is today compared to what it was. And then why treat pain? What's the purpose of treating pain? What effects does pain have on the individual? Me as a pain physician, I've seen certain individuals really not be bothered by their pain, not want to take any major treatment, but just kind of want to be educated about the sources of their pain. And then there are other individuals who want to do everything they can as fast as possible to treat their pain. So it also depends on the individual's expectations of their pain and what they feel that they want to do day to day that they're limited by. But why treat pain? A lot of times pain can lead to a poor appetite, weight loss, disturbed sleep, withdrawal from talking or social activities. Individuals don't want to leave the home. They don't want to talk to other individuals. They figure, hey, if I go out today, if I do this or I do that, I'm going to be in more pain, so I just might as well avoid it, which has been proven that the less activity you do overall, the more your body will be deconditioned, and perhaps that would lead to more pain. A lot of individuals who have pain, the pain causes anxiety, depression, sadness, or perhaps their depression and anxiety can cause pain and mental anguish. So it's kind of, they both work together to make life more difficult for the patient. And oftentimes treating the emotional aspect of pain, the way in which an individual's day-to-day life is affected by the pain, needs to be addressed. Some of the individuals who are most affected by pain and who are most distraught by pain and want to be most aggressive with pain management are the individuals who are very high functioning. Some of them are athletes, and then all of a sudden they had an injury, and the injury is healed or is on the way to healing, but they're not at this level of activity they would have otherwise been at had they not had the injury. And for them, emotionally, to be at such a high functioning status and then to come down and not be as functioning is very, very difficult on their mental health. Oftentimes we work with psychologists, pain psychologists, physical therapists, acupuncturists, all in a way to help the patient get over their pain and also to have hope and get over the emotional aspect that pain has on the individual. It's so interesting to see within pain management how the patient will come to the clinic and they will not be the most pleasant person. Sometimes they're physically or verbally aggressive to the staff or ourselves. Sometimes they're not thinking straight or not thinking clearly. They act out. Oftentimes they bring a loved one or a spouse, and the spouse will say, ever since they've been in pain, the patient has not really been very patient and has been very aggressive. And hopefully we give them some pain treatment. We kind of go through different techniques to overcome pain and cope with pain. And one of the first things that the patient and their loved one will say is, wow, the patient is in less pain, their pain is manageable, and they're actually a lot more pleasant to be around. And we always get kind of a thank you from the patient's significant other, which is always interesting, but it goes to show you that pain affects the individual. It also affects the individual's family and loved ones and partners. So let's just kind of focus on everyday pain, day-to-day pain. Anywhere between 80 to 90% of individuals over the course of their lifetime will have some form of pain. There is two general categories: acute, which is immediate pain, or chronic, which is daily pain that an individual's had for a long time. When you're dealing with day-to-day pain, the most common culprit will be muscle tension. How we hold ourselves, how we sit, our posture, any prolonged driving, prolonged sitting, oftentimes causes muscle tension. And what is muscle tension? Muscle tension is when the muscle fibers that we have that basically control our body and help us move, help us stand, give us some support and padding when we sit down, that muscle tension, it gets wound up. The fibers along the muscles basically can't relax. Now, if a muscle fiber cannot relax properly, what ends up happening is there's inflammation, which causes pain. And a lot of people will call it, doctor, I have like knots in my back, in my neck. I feel like I have tennis balls or golf balls. I can just feel it. And they'll show me specific areas of their body, as you can see in this picture, where there's muscle tension. And these areas of muscle spasm are called trigger points, because you can undergo different treatments to treat that specific area of muscle tension, either with a dry needle, acupuncture, foam rolling, physical therapy, stretching. And one of the most important treatment modalities that I always tell all my patients is to stretch daily in the morning and evening, because muscle pain is one of the most common sources of pain. And even if an individual has arthritis or other areas where they'll have pain, to strengthen and relax the muscle will help treat the pain tremendously. In this particular picture, you can see the larger yellow trigger points, and you can see that there's two along where the neck meets the shoulder, where a lot of individuals who are on their computer or do a lot of driving put a lot of pressure on their shoulder and neck. And if you look at the low back, it's a few areas. One is where the back meets the pelvis at the very bottom. And then another area is right or left of center. You'll see another big yellow dot. That typically will be where the quadratus lumborum muscle, which is involved with posture and oftentimes gets very tense, is affected. Certain physical therapists will teach their patients to use tennis balls to kind of lay on a tennis ball and relax specific areas of pain, or a lacrosse ball, which is even harder. But the whole idea is that you have these tissue muscle fibers which basically don't relax and remain tense. And our goal is to relax the muscles. Here's a more specific picture of what a trigger point is. Actually, in the picture, it's actual golf ball. And you know that these are areas where the muscle is generating pain because you can feel it. If you press on it, it can reproduce the pain, but in a weird way also feels like there's a release. There's a concept within medicine, which has been proven, that if you have areas of pain, a lot of times this can cause referred pain, which is pain in a different area of the body. And oftentimes patients will say, I have neck pain or shoulder pain, which goes into the shoulder blade, or I have back pain that goes into my buttock. And they almost always assume that it's a nerve or something that might be more problematic than a muscle. But oftentimes muscle pain can cause pain in multiple areas of the body. And I always encourage my patients to review what they do day to day that might be causing them pain, and review their posture, their sitting, what body position is their body in for an extended period of time. Common trigger points and areas of muscle tension. A lot of muscle pain can cause headaches. It can cause spasm of the muscles that wrap around our head. A lot of patients say they have neck pain, doctor, that goes into the back of my head, that goes to the top of my head, and it really just hurts my temples, the side of my head. Sometimes it goes to the back of my eye or jaw. Some individuals come with grinding their teeth at night, which causes them headaches. But essentially, the muscles are all connected. And when one muscle is tense, it affects multiple muscles above and below, and can cause more serious issues like migraines, headaches. Sometimes individuals will say that their back locks up. The pain is severe. They cannot get out of bed because it's so severe, but then the pain kind of resolves within a week or two. The single most important exercise that I advise all my patients to undergo is foam rolling and stretching. What is foam rolling? You'll see these little circles. They're made of foam, and they allow our muscles to relax because we're basically pushing the muscle along these foam rollers. And what happens is when you have these foam rollers, not only do they relax the muscle, but they force you to go into a posture that might be different than your day-to-day posture. So if an individual tends to sit a lot, when you use a foam roller in these particular positions, you're actually stretching out the muscles in the back and buttock as well as the front. And this is the most important exercise for daily stretching. That when I tell a lot of my patients who have more serious findings on their X-ray MRI, when I tell them to do foam rolling or planks, it helps their pain tremendously. A lot of times the physical therapists will go through these exercises, go through these maneuvers, and they'll set up an individual treatment plan. This is very, very, very helpful for individuals who are on the computer, who are leaning forward a lot, and who are always kind of hunched over, because if you put that foam roller in the middle of the upper back, you are extending, you are pushing your body backwards, and you are doing the reverse position of the position that you are in when you're on a computer. In this video, we see an individual performing the plank maneuver, which strengthens the core muscles of the abdomen. Why is this so important? Especially in today's society where a great amount of our time is sitting, driving, our core, our abdomen, the muscles that keep us sitting upright, standing upright, get deconditioned. And a lot of times the muscles stop working, stop activating completely. This is a simple exercise, but just holding this position for anywhere between 30 to 45 seconds, 2 times in the morning and 2 times at night, will make a huge difference in individuals with low back pain. This is one of the most common exercises that physical therapists review with their patients. And here's another list of common low back exercises and stretches that anyone can perform. If you particularly look at the quadrupled arm leg raise, just basically sitting on your knees and hands on all fours, and then lifting up one arm and then the opposite leg, will help create a tremendous amount of core strengthening. And then also the extension exercise, laying flat on your stomach and then gently pushing your upper body up, will help provide stability, help prevent slip disc, and also provide proper posture retraining. This extension exercise is the opposite position of us when we're sitting at a computer. One common modality to treat pain, which is very successful and very safe, is the TENS unit, transcutaneous electrical nerve stimulation, where you put these pads on a specific muscle and you can change the electric voltage. It's kind of like some people call it a mini massage, but what it does is that it basically forces the muscle to contract and relax, and it's a good way of helping the muscle retrain, relax. Oftentimes it's covered by insurance or fairly affordable if you buy it online. And kind of honing in on this idea of sitting and standing and lifting and proper posture and positioning, I always talk to my patients about how grandmother was always right, that sitting up straight is extremely important for the low back. If you can look at this picture of the individual with a curved back on the left side, you see that they're putting a tremendous amount of pressure on the low back. But when you sit up straight, you're distributing your body's weight and engaging your core, and you're really protecting yourself. Another old adage grandma was right about was bend with your knees. Well, when you don't bend with your knees, you put a tremendous amount of pressure on your hips and low back. One of the most common ways individuals injure themselves at the gym is they don't use proper form and technique. Oftentimes they don't bend their knees. When you bend your knees, you're taking a lot of pressure off the back and putting it on your hips and knees. So just simple ways that we sit, simple techniques to lift, simple procedures to extend our back, to use a foam roller will actually treat the vast majority of day-to-day pain and even chronic pain. And now that we've talked about common postures and computer sitting technique, I'd like to bring attention to a very, very popular topic within pain management, which is physical ergonomics. A lot of companies, small businesses, large businesses, have basically created a system where you can get an ergonomic assessment, or you can just be mindful of your own ergonomics, which is the way in which you are positioning your body. You want to apply it in the workspace to minimize injury and optimize efficiency. It was initially a field that was researched to try to help individuals be more productive. But you want to try to minimize stress on the body as much as possible to minimize mechanical pressure, improve posture. That could lead to injuries, occupational injuries. You want to prevent carpal tunnel. You want to prevent back pain, buttock pain, a neck pain, and keeping the body in a neutral position where the head is not moved forward, where the head and the shoulder are in the same alignment, where the shoulder, elbow, and wrist are in a 90-degree angle, as you can see in this picture, and that your hips and your knees are in the same alignment. This helps with the neck, low back, wrists, and it also just allows you to work throughout the day with fewer aches and pains. Another common piece of advice I give my patients who do a lot of secretarial and computer work, a lot of computer programmers, software engineers, is to take frequent, 2 to 5 minute breaks every 30 to 45 minutes and to set their alarm. And just a little bit of the why behind the pain. The spine has bones around it, the vertebral body, and it has discs. So you have a bone and a disc, a bone and a disc. And these discs are basically acting as springs. And depending on whether we stand upright, we're putting the least amount of pressure on our back. That's why a lot of individuals who are working on the computers are getting sit-stand desks, because when you stand, you actually put less pressure on the back. And depending on how you sit down, you can be putting a tremendous amount of pressure on the low back discs, which are ultimately the culprit and reason why individuals have slip discs and sciatica. But if you kind of sit down and you lean slightly back or even upright, you're putting a lot less pressure than when you're leaning forward. And that's why keeping the computer screen at eye level, keeping it close to the body so they don't have to lean forward is so important. I would say in today's society where we practice, where individuals are doing a lot of secretarial and computer work, this has become very, very popular. And when I explain this concept to a lot of my patients, they start to realize, hey, just how you approach sitting can help your pain. This also is analogous to the car. A lot of individuals do a lot of driving. When you lean forward as opposed to leaning upright, and when you have your hip and your knee positioned properly, it takes a tremendous amount of stress off the muscles and the joints. And this is one common diagnosis that comes into our clinic, which is sacroiliitis. Oftentimes it's confused with sciatica because it causes buttock pain and a little bit of back pain that radiates down, but it doesn't have any numbness or tingling. Oftentimes it's seen in women. Oftentimes it's seen in individuals who do a lot of sitting and put a lot of pressure on their buttock. When you have this type of pain, it can be debilitating, but it can be easily curable with anti-inflammatories, physical therapy, stretching, frequent breaks when sitting, and we could also do anti-inflammatory steroid injections to this particular joint under live x-ray. So this is a common area of pain people experience when they sit, because this is the major joint in between our tailbone and our hip bone. And it's the major area that undergoes a lot of stress. Another way of treating pain, multiple ways, but this is the most common way we see in our clinic, because individuals want to be able to take something, a medication, when they're in pain, and to not take it when they're not. But there are different categories. There are adjuvant medications. Depending on the pain, you can take nerve pain medication, which are becoming very popular and don't have habit-forming potential as much as other medications. Oftentimes, individuals with sciatica or any type of nerve injury, numbness, tingling, diabetes, shingles, are oftentimes treated with nerve calming medications. Another category is muscle relaxants. A lot of construction workers, anyone who does heavy lifting, people who do prolonged driving, individuals sometimes genetically are just born with stiff muscles. And as a result, in addition to stretching and physical therapy, muscle relaxants can provide a tremendous amount of relief. Individuals who are in car accidents who get rear-ended have a tremendous amount of muscle tension that needs to be addressed. Another common category of medication are NSAIDs, which are anti-inflammatories, such as Aleve, Motrin, naproxen, ibuprofen, meloxicam, nabumetone. They all are anti-inflammatories. And whenever you get muscle tension, arthritis, joint pain, tendon pain, there's a component of inflammation that worsens the pain that needs to be addressed. Another category of medications, compounding creams. There are creams that you can rub on particular areas of the body. Shoulder, joint pain, knee pain, hand arthritis, anything that causes injury to the joints or small joints that are close to the skin. There's anti-inflammatory creams. You can put any medication in cream form. Another category of medication which are very popular in the news are narcotic pain medications. Narcotic pain medications are hydrocodone, oxycodone, Norco, Vicodin, Percocet, morphine, and the list goes on and on. But this pain medication is very effective, but also builds tolerance. And as a result, individuals who take it over a long period of time need a higher and higher dose to get the same effect of pain relief. For acute pain, for surgical pain, for individuals who hurt themselves immediately, this is very helpful because it just helps you treat the pain while your body heals on its own. But what happens if your body has an issue that is not repairable or your body cannot heal on its own? A lot of times, narcotic pain medication is a way to treat it, but not necessarily always a good long-term solution, given the fact that it can cause dependency and addiction. And along with individual who has chronic pain, they might be at risk of having other issues. Currently, there is several governmental task forces, including the CDC, that's focused their attention on the opiate epidemic in the United States. About 80% of the world's hydrocodone Norco is prescribed in the United States. And as a result, the way in which pain management physicians and physicians in general have been treating pain has changed tremendously. In the early 2000s and before, pain management and narcotic pain medication would go hand in hand. Now we've kind of learned about the addictive potential of narcotics, the long-term negative impact on society, and we're trying our best to encourage patients to treat the pain and its underlying cause, and limit the associated risks from medication. We do commonly prescribe opiates, but we do it very responsibly, and we have a very regimented screening process. Another category of medication and treatment, acupuncture. We work with chiropractors, pain psychologists, physical therapists, and even aquatherapy. You can do therapy in the pool, which has been very helpful in individuals who have had hip or knee replacements, hip or knee pain, because in the water, your body doesn't weigh as much. There's a buoyancy to it. You have increased range of motion. And that helps patients tremendously when they want to strengthen the muscles, but they can't necessarily do it on land. And this is an area of pain management that we as interventional pain management physicians have learned and offer our patients. Previously in our discussion, we've talked about posture, medication management, TENS unit, stretching, strengthening, and now we've come to one area where we as pain management physicians dedicate a tremendous amount of our time, and we basically provide the added value is commonly epidurals, which you might hear initially for women who are pregnant. They get epidurals to help treat pain when the baby's coming through the birth canal, but also there's something called steroid epidurals, which you can get to decrease inflammation along a nerve that's being quote unquote pinched or affected in the low back. When a disc comes out of its place, it pinches a nerve going down the leg and you can get sciatica. And epidurals help with that. Another area of pain is arthritis. You can get arthritis in your knees and hips, shoulder joints, but there are also joints in the back between the bones, the vertebrae. Those joints are called facet joints. And those are common areas of pain, especially in individuals who are older than 50 or 60, or people who do chronic heavy lifting. On X-ray and MRI, it's very clear that they might have severe arthritis. And what you can do is you can do a facet joint injection, a medial branch block. You can put numbing along the nerve that sends the pain signal to the brain, and you can treat that pain. There's also a modality called radiofrequency ablation, which is kind of heating up specific nerves in the back, in the neck. People who get hernias and get surgery and still have pain after, people who get knee replacements. You can essentially heat up a nerve and stop it from working, called radiofrequency ablation. We do joint injections in the sacroiliac, which we had discussed, hip, knees, shoulders, different modalities, either with steroid, sometimes with knees you can put hyaluronic acid gel, or what's very common and popular is PRP and stem cell, which has had very good data for individuals with joint pain. Genicular nerve blocks and radiofrequency ablation for knee pain. Individuals who have intercostal pain, which is pain along the ribs due to a nerve getting pinched, other muscle tightness and what have you, we can block those nerves. There's individuals with organ pain, sometimes a sympathetic block along the nerves that involve sympathetic and parasympathetic. And also we'll talk about spinal cord stimulation, which is one of the newer modalities. It's been around for quite some time, but it allows for individuals who've had surgery, who have nerve pain, whether it's due to diabetes, peripheral neuropathy, get a implanted device which helps send a competing pain signal with the low back. And there's also individuals who have fractures of the bones in the spine that can benefit from basically a version of cement which will help the bone regain its original height and stability and support to the rest of the spine. Here's a common example of pain, which is one of the most common diagnoses that I treat. It's sciatica is the lay term, but lumbar radiculopathy, where you have specific nerves in the back that are being pinched. And the pinch, if you can see in the top right corner, is due to fluid and gel from the discs in our back coming out of its place and pinching the nerves. And when it pinches the nerves, it affects the entire nerve going down the leg. And a lot of times individuals will say, hey, I have numbness, tingling, pain, doctor, that goes around the top of my foot, or the bottom of the foot, or the side of the foot. And each individual area, specific toes, correspond with a specific nerve that came from the back. So depending on the location of the pain on the leg, I can correlate it with which nerve is being affected, and we get an MRI, we can get an X-ray, we can assess this. Oftentimes it presents with numbness, tingling, a burning sensation, pins and needles sensation. Individual will describe it and say, hey, I feel like I put my foot inside a light socket. And then typically it's one-sided. It may worsen with sitting, standing, bending, twisting, anything, certain people coughing, but it is very painful. Individuals want to get it addressed immediately. Sometimes it happens after traumas like car accidents, lifting something heavy without the proper technique. And then back to the whole concept of a facet injection. You can get in the neck, all along the spine, neck, mid-back, low back, and it involves first putting a small amount of anesthetic or steroid along the nerve, as you can see, that is not necessarily part of the spinal cord immediately like an epidural, but it is a branch of the nerve. And you just numb that nerve because that nerve controls the pain from the joint. That's its main purpose. So if you can numb the nerve that sends a pain signal from the joint in the back, and you can also kind of heat up the nerve so it stops working, then you can treat arthritis of the back. Here's an example of an epidural in a pregnant woman. An epidural, and the word epidural is the name of a space in the body where the nerves of the spine exit. So when you're getting an epidural, you're getting medication in the epidural space. And in this picture, you can see where the space is. It's outside the spinal cord. And in this situation with a pregnant woman, you would just put numbing medication because you just need it for a short period of time. But oftentimes, if you're having sciatica, you would have an anti-inflammatory. And in discussion with our live x-ray, we use very, very advanced techniques. We use an x-ray, a fluoroscopy machine. We shoot a dye when we do an epidural. We confirm the placement, and then we give the medication. And in this situation, you can see both from the front and back and side where the dye is. And then going to one of the more advanced ways to treat pain of spinal cord stimulation. It's very good for individuals who have already had back surgery but are still having pain. It's very good for pain that goes down the leg, any numbness, tingling, burning, diabetic neuropathy, shingles or post-herpetic neuralgia, pain after shingles, and then also something called complex regional pain syndrome. This is a modality that can be life-changing for several individuals. Here's an example of what it is. It essentially is a set of wires which are placed in the epidural space along the spine higher up. At first, you have a trial period where you just put the wires inside the epidural space and the wires come out of the body. You connect it to a little machine that's a belt, and you have a remote and you can change the settings on those wires over the course of a 3 to 7 day trial period to see if you would want this implanted in the body. So you get a trial for 5 to 7 days, you get wires placed in the epidural space, you get a remote to change the settings, and we kind of walk you through all the different settings. And then you say, hey, did it help your pain? Were you more functional? Were you able to do more? Were you more active? And we remove the wires, and then certain individuals benefit, and then those wires are again put in the body, and then there's a little machine that's implanted under the skin, and the machine is recharged from outside the body, and you have a remote so you can turn on or off the machine and change the settings however you like. Here's another example of a spinal cord stimulator. The different types of areas, the sweet spots where you want to put it. It essentially is mapping out the spinal cord so that when an electric impulse is sent, frequency is sent from the wire positioning to the spinal cord, it covers different parts of the body. Just want to say thank you very much for listening to my lecture. Hopefully this was helpful. I am part of Facey in Mission Hills, and if there's anything we can do to support you live a pain-free life, we would be very happy to help.